Good afternoon. I hereby call this sixth meeting of the Kentucky Health and Human Services Delivery System Task Force to order. If you would, please silence your cell phones. And Secretary, if you would, please call the roll.
Senator Rocky Adams, Senator Funky Fromeyer, Senator Harper Angel, Senator Mays Bledsoe, Representative Heverin, Representative Mosier, Representative Neighbors, Representative Stalker, Co-Chair Meade, Co-Chair Meredith.
Present. And Senator Funky Fromeyer is now in the arena, so we will count her as being present as well. Next order of business is approval of the minutes, and I've received an email, I don't know if many of you did, that asked we have a couple of corrections to this. First being that the correct spelling for the company providing the call centers is Conduit, which is C-O-N-D-U-E-N-T rather than C-O-N-D-U-I-T. And secondly, it was noted that Commissioner Dennis stated that the locality premium for Jefferson County is given based on in-person claims. The office helps dailies. And apparently what she said was that they work with a large population that is not English speaking. And it has been asked that we make that correction to the minutes. And any questions, concerns about those suggested recommended changes? If not, could I have a motion to accept the minutes as proposed amendment? Motion, is there a second? Second by Representative Hepburn. All those in favor say aye. Thank you. Next order of business is approval of the findings and the recommendation memo that was, I think, sent out to you this past Friday. So we will start with the findings. Obviously, capsule summaries of our discussion over the last 5 months, and I was a little bit amazed that we covered as much ground as we did. A lot of important subjects that we had to cover, but does anybody have any particular questions or comments about the findings themselves? Seeing none, is there a motion to approve the findings as presented? Motion by Co-Chair Meade. Is there a second? Representative Neighbors, that's the second. Thank you. All those in favor vote aye. All those opposed vote no. All those in favor? Any opposition? There being none, we'll move on to the recommendations. Again, you folks have an opportunity to review these. Just a couple comments I'd like to make specific to the recommendation about the Medicaid Oversight Committee. You folks know that have served on this task force and in this interim period in the previous one as well that Medicaid is a big part of the budget for Cabinet for Health and Family Services. And I think our recommendation last year to include that under health services were well intentioned, but the reality is that we have not been able to devote the attention to it that probably it should be given. And one of our recommendations is to reinstitute the Medicaid Oversight Committee. I think this is very important. At our next Health Services Committee meeting, we're going to have a report from Medicaid, but again, that's just 1 month during the interim that we're able to consider issues, and there are a lot of issues within the Medicaid program itself. But I would just add that comment to the recommendations. Any other comments, concerns? I'll give you a moment to take a look at these. Representative Stalker, you have a comment, question?
I do. I've got a couple of questions. Under number 7, is the recommendation that the General Assembly is going to be appropriating additional funds for the GALs?
We could be, depends on the legislation that comes out of these recommendations. That's something we'll have to work on when session goes in, when we go in session. But we haven't formulated a bill yet to make that decision.
Okay.
And I think probably we want to have some discussions with Representative Petrie and with Senator McDaniels as well. Because I don't know where we are in the budget process for them to even consider that.
Okay. And then second question.
Yes, please.
Recommendation number 8. This was really the only recommendation that I am opposed to. I don't know why we would want to bring in some folks from the private sector to handle this when it feels like we're probably going to not create the efficiencies that we need, simply because under my impression is that they can only handle so much of these cases before they have got to get handed off over to an actual state employee. So I would just say the only concern that I have is that we don't parse that out to a private agency, that instead that we would want to consider hiring more state employees, instead keep folks who are already familiar with the work closest to this, and not parse that out privately.
I appreciate that question. Co-Chair Meade, do you have a response to that, or would you like me to?
I would just say that in the past, there have been times that we have partnered with private agencies to clear some of these roles out, and there are pieces of that can be used or can be done by those private companies or private contractors as opposed to the entire thing. So there are pieces that we could go ahead and contract out to try to help those staff to get moving along. I think the other issue there is also with state staff, it's very difficult right now to hire enough people, so that would be beneficial for us, I think, to use some of those contractors.
I would add to that, we have a lot of pushback about statewide processing of these applications, and I think it's been very demoralizing to the various counties that have been assigned this responsibility. You remember during testimony that this has been going on, an ongoing problem with Jefferson and Fayette County, going back as far as 2019, and the issue's always been the same: not enough staff, maybe inadequate training of staff, but we haven't moved the needle. And I think this is just an attempt to change the status quo. As noted, it would be a pilot project to see, and it isn't without precedent. With our healthcare system, we have private partnership with our MCOs to manage the health of our population. Also, with our foster care program, we use an outside agency to administer that program. So again, it's not without precedent, but it's just attempting to change the status quo and hopefully move this situation forward. So, Representative Hebron.
I would actually like to add on to what you and Co-Chair Meade had said. When I was at State Treasury, I was the director of unclaimed property, as well as several other initiatives. But we actually partnered with an outside private company where it was actually a huge morale booster to a lot of our staff because we were so behind from the new administration. And it really it gave the staff there the opportunity with unclaimed property. We partnered with, I think it was Conduit at the time, but they took a lot of the work on the back end, and it became a much easier process. And morale was so low because it just seemed like all the time we were behind. And so with the extra help, it helped them get on task. I don't want to say on task, but on schedule, and it wasn't so daunting. So the state staff would have the final approval, but I mean, just for me and the director, it was a huge morale booster. And I think that's something, if we can give morale boosts in state government, we should try as much as we can. So it's not necessarily like taking away work. It's just almost like another tool in the toolbox for them to have the, to be able to serve to do the actual position that was there, not get bogged down in all the paperwork, if that makes sense. Mm-hmm.
But thank you for your question, comment, Representative.
Sorry for no question.
Any other comments, questions about the findings? Excuse me, the recommendations. I'm sorry. There is a motion to approve.
I'm
Yes.
sorry.
Okay.
I realized I missed the boat when you had asked earlier about the findings. This connects. Our fourth finding, I believe it was number 4, was around childcare, and I just was realizing that we don't have any recommendations to address this.
I think that's because, I won't say because, there's a lot of conversations with Representative Heverin and Senator Carroll with the Family and Children Services Committee. I think you will see legislation coming from that committee specific to this. So, again, I want to use that example of how the work of this committee has helped the situation. Previously, we had the Health and Family Services Committee, and the issues with Family and Children Services always seemed to take a back seat to healthcare issues, and I don't think that was intentional. It's just we're overwhelmed by the amount of work that needs to be done. And I think that the discussion we've had in this interim about this subject validates the decision to establish a separate Family and Children Services Committee, and I'm very appreciative of that. But again, I think that work will be conducted by them, and that's where you'll see the legislation come. I have no idea what will be started on the House side or the Senate side, but we will be working in concert together to make sure we address this issue the best we can, because certainly it is a serious issue. So recommendation to approve the the recommendations, motion to approve the recommendations. Is there a second? Most certainly.
And a number of the folks that have testified over the last few months, sometimes I do get that a little confused with some of our conversations in the Health Services Committee as well. But one of the acknowledgments are the number of therapists to those that need care, and that we actually don't have enough people providing the care. And I didn't see that within our recommendations, that we were providing some amount of control or releasing control as the legislators of how many persons per therapist can be being provided care. It just seems like we keep coming back to a shortage of providers, but then we have so many people needing care in the queue, but we're not getting the queue cleared up, and we can't hire people quick enough. So are we somehow reducing the potential of providing care by restricting it legally? Are we creating a barrier?
But just a personal
Sorry
opinion
for
about
that confusion.
I appreciate that, but just a personal opinion about that. I don't think so, because the impediment to care right now is not because we haven't put those standards in place. It's just a lack of personnel, particularly specific to the mental health issues. And we certainly have authorized through the budget for the cabinet to hire those positions. It's just they haven't been out there and haven't been aggressive. We've also talked about the impediments to hiring that exist because of our personnel cabinet and our kind of parallel efforts in the County for Health and Family Services to hire personnel as well. And we've asked them to work together, and I think they've done some preliminary work on that to try to address those issues. But again, I don't think it's because the lack of a standard as to the number of people that should be treated through therapists is the problem at present.
Just wondered if that the 5 patients per one therapist seems to be a small number compared to the patients that need care. And some of the feedback, I don't recall whether we heard it in testimony, but some of the therapists acknowledging that they could have a heavier caseload, but that they're not authorized to have a heavier caseload.
Well, I'll go to another one of our recommendations there, and that is to continue this task force during the next interim as well. And almost from the get-go, we had said that this is such a huge cabinet, and it's kind of a Gordian knot that's been created. It's going to take a while to take it apart, but again, that's one of our recommendations, is to continue this, and I'm sure we'll have additional discussion about this if we're authorized to continue the task force next interim. Representative Moser?
Yes, thank you, Mr. Chairman. I have a question about recommendation 5. I'm reading this and I'm not sure. Are we just concurring with the cabinet's current ability to give the state a 2-week notice to pick up a child with a high acuity, or are we saying that the residential treatment facility can't eject the child? I'm not clear on this recommendation.
Are you sure you're talking about the right recommendation there? Because 5 deals with the waiver slots.
Oh, sorry. Okay, all right. I will withdraw my question. Thank you.
Thank you. Any other comments, questions? Senator Adams? Excuse me? Oh, you second. I'm sorry. Thank you. Appreciate that. We do have a motion and a second to improve the recommendations. This is by voice vote as well. All in favor, vote aye. Any opposition? All right. Thank each of you for your work. This is a very difficult task force, very complex situations we're dealing with, and I appreciate your all's attendance of these and your participation. I think we've done some good work, but the work apparently is just starting. But some major issues that we will be dealing with in the future as well. So, there's no further business to come before this. Motion to adjourn.